Hi, I'm Dr. Jeff Banas, and I'm going to talk a little bit today about heel pain, more importantly, what you could do to get relief from chronic heel pain. Now, one of the reasons so many people suffer from chronic heel pain is because not all the areas are necessarily being addressed, okay? Just because you have pain in the back of the heel, that doesn't mean that's necessarily the only spot where all the problems are. So, and the more things that you go after that are wrong around the foot and the calf, the more relief you get from the heel. So what I'm talking about mainly is a lot of people experience a lot of pain in here, okay, the back of the heel. And you get that because you get a lot of tightness in the back of the gastrus or the calf muscle, and that tightness in the back calf muscle causes an increased tension in the back of the heel. Okay, now just going in and giving an injection in this area, it will give you temporary relief maybe from that, but you didn't address the cause of the problem. And that's what I'm going to talk a little bit now, addressing the cause of the problem so you can finally get relief from that heel. So most of the time what's happening is you have tightness in the back of the calf, and that causes an increased tension on the base of the heel, and that leads to tendonitis, little bone spurs, bursitis, okay? So what we need to do is we need to look at the big picture and address everything, okay? So one of the first areas we address is the back of the calf, okay? Up in the back into here. We have the muscle that comes down here and then attaches onto the tendon, attaches onto the back of the bone. And a lot of times what you'll do is you'll get a lot of trigger points or adhesions in your calf way up in here, which is going to cause the muscle to become tight and then cause more tension. So the first thing what you want to do is do deep tissue therapy on your back of your calf. Now you can see a massage therapist or a sports therapist for that. You could do stick work. You could take this type of stick right here and you rub it on the back of your calf. You'll find the knots there. You could go ahead and also use a foam roller. You can just Google foam roller on the calf or the stick on the calf and they'll show you how to do that. Because what we need to do is we need to reduce the tension on the back of the heel right here. Another thing that you could do is get a custom orthotic that's going to give a little bit of support on that arch and then cradle that heel and then also give this a little bit of a lift. So a custom orthotic that we make here commonly for people is we want a kind of a little bit of support to give that arch a little support, because a lot of times on a lot of people their arches drop. Okay, so if that arch drops, the foot's going to rotate in and it's going to then cause more tension on the foot. And so we build up an orthotic that will give you some support on that arch, and also if the foot's pronating or dropping in, commonly what we do is put a medial heel wedge. And a medial heel wedge means on the inside of the heel, and only on the inside, it's a little bit thicker on the inside than outside, and that's going to control that ankle from rolling in. Because if you're having a lot of pain here and your ankle's rolling in, your arch is dropping, you could get therapy on your calf or your heel, but then you get up and start walking around on it and put a lot more tension out there. So, and by giving this heel a little bit of lift, it's going to reduce the tension on the back of the calf. So another thing what you could do to give a little bit of support is use a stuff called kinesio tape or rock tape. And you typically tape that on the bottom of the foot and right up on the calf. And what this tape is basically doing is it's thinking it's like adding another tendon to your calf, or it's giving a little bit of support to your calf and your Achilles muscle. You could do this yourself. Again, you could just type in rock tape, Achilles tendon, or kinesio tape, the calf or Achilles tendon, and you should be able to find a way on how to do that yourself. Now, a couple other things that you could do that we see. A lot of times people get a lot of this tightness in the back of the calf, and a lot of it is because sometimes a lack of magnesium or a lack of the relationship between calcium and magnesium. And what we found is if you use this stuff called topical magnesium, and you can go ahead and get this at a lot of your health food stores. It's just a topical magnesium, and what you're going to do is you're going to rub that into your calf and rub that into the heel. What your body's going to do is absorb that magnesium, and if you think of like a concentrated Epsom bath, so you know doing an Epsom salt bath to get that magnesium for sore muscles, this is a little bit more concentrated, and you go ahead and put that right into that area. Another thing is a really high concentrated amino acid supplement. It just helps with muscle type of injuries. Ibuprofen and stuff like that, it actually will help with the pain, but if you use it a long time, it actually slows down tissue healing. So you got to be a little bit careful with that. So because we see a lot of people coming in here, and they're coming in and they got a lot of pain in the back of the heel, and they've had injections and certain types of meds, and that's all they've had. So the ways you could address that is a custom orthotic with some arch support, maybe a medial wedge, in a heel cup. You could put some kinesio tape or rock tape around there. You could use the topical magnesium and rub it into there. High density amino acid will help with muscle type of injuries. Deep tissue therapy, by seeing a sports chiropractor, massage therapist, or physical therapist, could do some deep tissue therapy, or the therapy is called active release or Graston type of release. You could definitely do the self-myofascial release by the stick and the foam roller. And if that doesn't do it, I mean, that's typically how we treat patients up in here. We would do some other stuff in addition to that, like run an electric muscle stim into that heel, acupuncture to kind of stimulate blood flow in there. A lot of times too, this joint needs to be mobilized too. So one of the things what you could do is keep your foot flat on the ground and push your knee forward. And see how many inches your knee goes in front of your toes while your heel is still on the floor. And you should be able to get 3, 4, 5 inches. If you're getting 1 or 2 inches. So what I'm saying is we keep this right here and you're flexing your knee forward, and we should get way up in here as far as your knee in front of your toes with your heel on there. If you're only getting 1 inch or 2, that means this joint is very rigid. And then you need to see some type of sports chiropractor or physical therapist that's trained in mobilization of that ankle. So if you have any questions about that, feel free to check out my website or drop us a line.